Okay, they're wrestling.
We got to make sure you take care of the cat first. We good?
Okay, we're good.
Okay. Hi, everybody. Cats first, because that's what we do here. I'm so excited to have you today, all of you, because we're going to be talking about blood pressure with the cat LVT, Ellen Carozza, who I always pronounce that wrong. Did I get it right?
You got it right.
Oh, good. Okay. We're gonna talk about blood pressure. We're gonna jump in, but I wanted to thank Basepaws for bringing us together here and for doing so much to bring actual quality veterinary information based in science to every cat lover out there that wants to get a hold of it. Sometimes it's so hard to know where to look for quality information. Here's a spot. Here's a spot with credentialed people who are going to only tell you what is proven based in science. So, with no further ado, hi.
Hi, how are you?
I'm really good. I'm really good. I'm excited to talk about this today because it is so easily overlooked.
Yep.
And it's actually kind of a big deal, particularly in cats. If you think about it, when we go to get our checkups, they get a blood pressure every single time.
Yep, every single time.
We're not. So I'm gonna do a little do-si-do your partner here. So I think you're gonna be. Oh, wait a minute. Nope. I got to do a little something else here. I got to do my share screen. So I want to talk about why it's so easily overlooked. And what is it? Why does it even matter? So look, there you are, so cute with your. Are you seeing my screen now? Are you seeing my?
I sure am. I'm seeing your screen.
All right, you're adorable. So I want you to start with explaining what is blood pressure anyway? What does it mean?
Right. So blood pressure, in the easiest sense of the words, is the pressure of the blood against the vessels in the body, right? That's the easiest thing. What people don't understand is when they hear about, I have high blood pressure, they automatically think about blood vessels and everything all the time. They don't think about the other organs that are actually targeted when you have high blood pressure, like particularly in cats. Like you got the brain, you got the eyes, you got the kidneys, you got the heart, affects the heart too.
I want to dial way back though, because for me, it's like when I go to a dinner party and I say to someone, "Oh, what do you do for a living?" and they say I'm a consultant, and everyone's like, "Oh yeah, consultant." I'm like, I don't know what that means.
Right.
I really want people to understand what it means. So you got the blood doing its thing, moving around the body through the blood vessels. And you've got the heart pumping.
Yep.
And so when the blood pressure is normal, all those things have evened out. And it's very complicated, really, because the heart's got a whole bunch of pieces and parts, and the vessels have pieces and parts, but then you also have lots of hormones that affect. It's really very sophisticated because your blood pressure has to be able to change on a dime to take care of your body as your body.
Right, to get that homeostasis going at all times. Yes, absolutely.
So
including, I'm sorry, what did you say?
I said it's super complicated, but I want to try to find a way to make it as simple as we can.
Right. So, basically it is, when you think about it, blood pressure itself is just simply the adjustment of blood pressure in the body. You want to have a nice level of homeostasis. You can have elevated blood pressure, which you can have elevated blood pressure simply by talking to somebody in a Zoom meeting, right? You get all worked out and excited over it, and the heart starts to pump harder.
Yes,
right? And so your blood pressure can increase.
When you see it go up, that's because the heart's pumping harder.
Right.
The vessels are constricting down more, or the vessels don't have, or the heart doesn't have the ability to be flexible.
Right. And so there's different ways that blood pressure is affected by, the heart itself, even under anesthesia. You might not have the heart perfusing properly. You can have a normal heart rate and rhythm, but it's not perfusing properly. So it's about perfusing the blood through the body.
And I think
and actually getting the body completely oxygenated properly. And everything. And so over time, it stresses everything. And so maybe the heart can't perfuse properly anymore. Maybe those vessels are starting to fibrose a bit. And so things can't push forward. So now you need the aid of medications or adjustment of medications to help the body actually function back down to a normal homeostasis, to actually perfuse the blood through the body. It's all about moving blood,
So the
whether or
blood
not you're
flow
moving blood
everywhere.
at a fast rate or a low rate or like within a normal rate. And it fluctuates, just like you said, at all times. The reason why it's so overlooked, it's because everybody thinks it's just normal to have fluctuations with blood pressure. But over a period of time, if you have consistently high blood pressure, it damages the organs over time.
So what you're
So
trying to tell
that's
me
what
is
you
that
want.
part of that fancy homeostasis word means things got to even out and be what our body needs to be even.
You want normalization.
So our organs, and we're going to talk about a few very special important ones, where if that blood pressure changes too much, it's either too high or too low, the organ can't tolerate it and we get damage. Right. So what are those organs? So you talked about the heart, and I think even myself, sometimes I forget the heart needs perfusion. The heart needs blood to be able to do its job.
Right? You don't got a heart, you ain't gonna survive. So you got to take care of it.
Pretty important. So we need blood to get to the heart, or we're gonna not be here. What other organs are really sensitive to that blood pressure?
Right. So in cats, it's particularly the brain, the eyes, and the kidneys. What we're also looking at. Those are the target organs that tend to be damaged from consistent elevated blood pressure. And it doesn't have to be a chronic over time. It can be an acute event that can cause it, that can actually cause organ damage as well. But typically, cats, I have a little kitten that's climbing on my desk here. Oh, everybody say hi to Zachary Bing.
Hi, Zachary.
So cute. Goodbye. I'm going to go that way now.
What's Zachary with you for?
He's just getting in trouble. He jumped from the couch to the little wall that we have here, and then behind my husband's computers, and then like onto my stuff. So there was a good chance that he was going to turn something off on us.
You're pretty much the field pioneer for neonatal medicine in cats. So when I think of a kitten at your house, I think it's got some serious illness. The fact that one's jumping hither and yon, you've done your job. That's good news.
Yeah, he actually came to me healthy, and I was like, "Oh, something's wrong with you. You're like normal. Like normally, you're like it's Team Scratch and Dent all the way here. I do have 2 Team Scratch and Dent members spending the Thanksgiving holiday with me, so he'll even things out. Because a little bit of feline homeostasis here too.
People who may know other super famous people who do kitten work, they kind of get all their information from you. You're kind of a rock star. You wouldn't say that about yourself, but I can say it about you.
No, and I really enjoy like working with everybody. I love working with everybody in the veterinary community like you, and it's like you got to get that information out there and share it, so like the public actually understands that the veterinarians are like out there to like make sure that these cats stay healthy, that we're able to evolve medicine, just like we evolved the feline hypertension toolkit with the American Association of Feline Practitioners. We built a toolkit for everybody to utilize to understand feline blood pressure, how to understand it, how to perform it, how to maximize it for the use in your clinic. And so it's not like a chore for it to be done. You were saying earlier that when you go to your own doctor, you wind up having your blood pressure taken like almost immediately, like when you go into the room. And meanwhile, you've just got through a stressful car ride. You got to go to the doctor's office. You have to like sign in and give them like all of your information right away. And so your blood pressure goes up, and the nurse comes in. She's like, "I'm going to take your blood pressure." And you're like, "Oh, it's going to be high. They're going to say something about it." And so your blood pressure gets up all for that. You just get worked up over nothing. Well, imagine how these cats feel coming into the clinic, and they're a prey and predation animal, so their stress levels are through the roof. You might get that one golden cat that's like, "I love you ladies, and I'm going to visit you every single week." That normally doesn't happen, but you'll have these cats that need to come in, and they actually have to like, he's back again, acclimate to the room. And so that's one of the reasons why a lot of people don't get their cat's blood pressure taken at the veterinary visit unless they're like at a specific age when everybody's told like you need to start paying attention to their blood pressure when they're 7. Well, why 7? Why is 7 the golden number? Why not every single time?
Yeah, and I have to say, I'm guilty of this as a practitioner because as I was growing up, when you know better, you do better. And it was always
Right.
like, well, they're going to be stressed, it's going to be high, so why bother? Or like, there's lots of common misconceptions as to why you can skip it. But we know
Right.
that the most important thing with cats is trends over time. So
Yep.
if we were able to have gotten that blood pressure at your annual visit when you're 3, 4, 5, if we see a spike, then we know to look for what's causing it. Like those are really important. How do we do it, cat LVT? How do we get that blood pressure without making the cat freak out? Now, when you do it on a person, we've all had it, right? We get the cuff and the stethoscope, hearing our blood move. How do we do it on a cat?
Right. So there are a variety of different machines out there, like the high definition oscillometric, which are just fantastic. If you don't have one in your clinic, get one. They are amazing. They make zero noise. The cats tend to tolerate them very well. While I know many clinicians and cardiologists really like the Doppler, some cats do not like their fur being parted or wetted down. If you do not have headphones to use it, it has that awful speaker from like 1960. It's a very antiquated looking machine, but it's meant to be a speaker for everything to be heard. But the cat usually is like, I'm not really happy about having like ultrasonic jelly or alcohol put on their either their tail or their feet, where you're going to have to actually get this pressure from, versus some of the new machinery out there that's, I would say, more pet friendly.
So this is old school, what we're looking at here on my slide. So it's kind of really similar to what we do in
Very
people.
similar.
So we have that little special teeny little cuff so that we can actually do that same thing to squeeze off the vessel and then slowly let it back up. And what's kind of hard to see in this picture, where the doctor in the picture with the human has the stethoscope on the elbow, the crook of the elbow in a cat, we need to find a vessel that we can hear. So you were talking about the Doppler, and it's on the underside of that cat's paw, between the cat's paw and the veterinarian's hand there.
Right. So it's right underneath the big bean is where you're going to put it. You put it right there underneath the big bean. The problem with those machines is, if you look at the photo, there's an amplifier on the table, right? It's a speaker. So if you move that crystal around on that foot, it goes, and of course the cat's sitting right next to the speaker, and the cat's like, no, thank you, and they jump off the table, right?
Yeah.
So you have to wear a set of headphones for that.
It's really, even loud in the headphones, it's kind of jarring.
It is. And then sometimes you're listening and listening and listening and listening, and then the cat's getting agitated. The person who's holding the cat is getting agitated. If you look how they have like the arm like hyper extended out, like that actually can affect blood pressure, especially if the person has like a good grip on that cat's like upper arm. You're blocking blood flow.
And we forget that many cats as young as 3 years old already have osteoarthritis. So if that cat has some arthritis in its elbow or its shoulder, that sucks for that cat right now.
Right. And so you're also using the sphygmomanometer, right? That the bulb syringe right there.
Yeah.
And so sometimes and I have seen it, some people in my practice are quite guilty of it. When they go to use it, they're like, and they white knuckle grip it, right? To pump it up. You actually don't have to. You pump it up enough that you can hear, and gently pump it up. So it's like maybe 10 to 20 points beyond not hearing that heart whoosh anymore. And then you start releasing the pressure. You don't have to dial it all the way to the very end. So that can be another creature comfort for the cats right there. But the newer ones, such as like the high definition oscillometric, it actually measures it out the same way. It doesn't have the loud noise. You might hear a couple little like clicks here and there as the machine is measuring, but it will not put too much pressure on the limb or the tail that's being utilized. It gets it to the point where you're no longer going to get that whoosh, because what happens with those is it reads the thump of the vessel against the pad of the cuff, and that's how it reads the actual blood pressure. And those will do diastolic and systolic blood pressures,
which is really nice.
It is nice. And then, you get the people saying, well, one number really doesn't matter. It's nice to actually see it on a screen. Like when you're actually like, okay, I could see actually two numbers. There are some people that swear on the Doppler they can hear both diastolic and systolic pressure in cats. I can't. My hearing is not very good. I am aged. So, I love the
I always
HDO.
use the old tool, and it is very sensitive to technique. Like you and I,
It is.
It's still worth it. We're still going to get
Mhm.
a useful number, but if
Yep.
the clinic can swing one of those new, or if you feel like making a donation to your clinic this year,
Right. And even the other oscillometric ones that are out there, like the pet map, is still utilized in practice. It's, noise free. It seems to be a little bit more cat friendly. But some of the newer tools, yeah, they're a little bit more costly. Is it worth it in the end? Like, absolutely. It was a game changer when we were making some clinical changes at our clinic in the past few years. I said, you know what? I think we need some new equipment. I would like to get these, even though I have Dopplers. I have like 3 of them. I wanted the high definition oscillometric ones, and it's made such a difference for my assistants when they go into the rooms and they're assisting the doctor. They're getting more blood pressures. It's wonderful for use with pets under anesthesia. I get much more accurate results. You set it and you just utilize the machine as you need to. And then you don't get I got to take this all in. The cat's going to get upset. And so it's definitely more feline friendly. So they're more likely to do it. And to get your 5 pressures, and then do your mean average is a lot easier than this few moments of stressing out an animal and having to actually restrain it. The HDO and stuff like that, if you put it on the tail, most of the time you can be giving a cat a cookie, talking to the client, getting other statistics on the pet while you're doing all of this. But the main thing is to get an accurate blood pressure with a lot of these cats is allowing them to acclimate to the room. And the majority of the time, that's not going to happen because you only have so much time to work with the patient.
So if you can, you're going to carry or train your cat at home. And that doesn't have to be scary. Carrier training can be pleasant and fun and a part of your world that's nice. And then the trip to the vet now you're not starting off at DEFCON 1, which I've always called DEFCON 5, and I just found out I was wrong. I'm going to keep saying that because I can't.
5 is a bigger number.
5 feels more important. But then your cat's going to do the best that they can to get to the hospital chill. But even just walking in that room with the clanking and the shiny metals and the smells, it's a lot. And so if we can give them, what do you think, 5-10 minutes in the room?
About 10, a good 10 minutes. So during that 10-minute period of time to let the cat come out, acclimate itself, just open the cat carrier, let the cat do their own thing. Don't touch anybody. That's your point to go get the history while you're chit-chatting. And I know it is so hard not to want to do everything else. So then the doctor has a maximum period of time, actually touching that animal. And believe it or not, when you guys do your physical exam to a client, it may seem like sheer moments, but you guys are doing so much in maybe less than a 3-minute period of checking this out, checking that out, knowing all of this. And it's quite amazing when you're able to do all that stuff in such a short period of time. But in that short period of time, you have an animal that's just like a ball of stress. So if
you're not getting as good of an exam,
right, you're not.
Yeah.
You're not. And then particularly then if you have a cat that's sick, that has hypertension already, that might be an absolutely false number. If you go ahead and take that blood pressure and you're like, well, I have you on medication. Why I feel like you're not responding to it. But then the cat at home is acting now normal. So is it like that white coat syndrome when they come in? Or is it from your cuff being too loose, your cuff being too tight? All of these things we have to troubleshoot out. So, it's not, while it's recommended, it should happen all the time. And it should happen at every visit, particularly in your senior cats or cats with comorbidities. It may not be feasible for every single cat, depending upon what's going on with them. But yeah, it should happen every single time.
So a high blood pressure is going to happen either because the heart isn't isn't pumping properly or the vessels are too tight. And
Right.
that makes us think about a lot of reasons why it's happening. What are some of the things we want to think about for why we're getting a high blood pressure?
Right. So, do we have a comorbidity? Do you have hyperthyroidism, which kind of dances with hypertension all the time? If you're hyperthyroid, you should be having your blood pressure taken, right? It's a metabolic disease. If you have a super high metabolism, your heart is going to be racing. Of course, your blood pressure is going to be higher, right? What if you have kidney disease? Nobody ever really thinks about cats and kidney disease and their blood pressure. Yeah, their kidneys are directly affected by blood perfusion. So we got to check that out as well. So
And
anybody who
that one's tricky because high blood pressure can cause kidney disease, and high blood pressure can actually make the kidney disease seem less bad than it is. So
right, and under anesthesia, even if you have hypotensive, long-term hypotensive events, they'll hurt your kidneys too.
So if you're in surgery and your blood pressure goes down for some reason,
and it's down for long periods of time, sure can hurt those internal organs too.
Yeah.
And then when they come out of anesthesia and everything's normalized, you have to monitor that patient for any kind of post-operative issues. So will those cats have hypertension in the future? There's a possibility if the kidneys are damaged, right? So those are all these things that you have to think about as well. Also, cats with hypertension, and you were talking about this earlier, that how we have to follow trends with cats.
Yeah.
And how cats are so good at hiding disease. Many times we don't know these cats have hypertension until they're very hypertensive. And that's usually indicating of, when we go to the brain, that they're yowling in the middle of the night, or they're just, acting on edge at home, or, they've suddenly now noticing them eating more, getting really thin because of hyperthyroidism, like all these things. Like cats are like fantastic at hiding all of that stuff. So it is important to follow the trends before we run into a problem. And so when you start off sooner rather than later, before the problem actually is there, maybe you can do something about preventing or treating disease on the early onset versus later.
If we don't take care of it and we let it go, we can end up, we haven't talked about the eyes. You can actually all of a sudden go blind.
Yeah.
Let's talk about that.
You can from hypertension. You sure can.
So your cat all of a sudden feels like they're acting weird. They're not, jumping. They could actually be blind from hypertension.
Yep. Right. Or those weird incidental strokes that they'll suddenly have that they're not normal. Is that from hypertension with the dealing with the brain? Now, one thing that everybody should know, that if your cat does go blind from being hypertensive many times, once it is taken care of, your cat will regain their vision.
So I think a lot of us, and maybe even me on occasion, even though I know better, I will not go because I don't want to hear news. But the thing is, and that's hard. I mean, that's human. But the thing is, if we can get that news and deal with it, we really can make big differences in the quality and the quantity of these cats' lives with this information.
Right. It's all about processing that. And it's like almost like having like a small moment of grief when you're being told like not so good news from your veterinarian. Learn how to process it. Educate yourself about the disease and be more proactive about being better about, veterinary visits. Stay on top of it. And that's where the long-term care comes in, that we're able to actually do more for your pet versus when something you actually have like an acute event happen. It's easier to take care of the cats that are on this steady rolling care plan versus like, now we have a sudden problem. Now we need to get serious. Well, I wish we got serious 6 months ago.
Let's say I have a 14-year-old cat and I haven't been to the vet in 3 years.
Yeah.
And I think everything's fine. But you convinced me tonight I'm going to go. So I go in and they take the blood pressure right away and it's really high. What's going to happen now?
Right. So you being the veterinarian, you're probably going to be like, baby, we need to retake this in a few minutes. Let's get this cat to acclimate first. Let's not do all the stuff, especially if you haven't been to the vet in 3 years. It's a shock to anybody. let the cat acclimate. You're going to do that physical exam. You're going to recommend the blood work, particularly with their age. I'm sure you're going to recommend that thyroid level that's going to be in there as well. Depending upon what you find, if there's a comorbidity present, you're going to treat that comorbidity, and you're going to recheck that blood pressure to see whether or not treating that comorbidity is going to actually treat that blood pressure.
So for the average comorbidity means they're sick from something else.
Right. So like you're hypertensive, you have kidney disease already. Is it something that's contributing to that elevated blood pressure? So treat that. You have to wind up treating that as well, and then see whether or not the blood pressure either equalizes itself out, or while we're waiting and that blood pressure is so elevated, let's get you on something to decrease that blood pressure, see if we can make you feel better while we're waiting.
Talk to me about that. So we're going to go on medicine. What does that look like? Is it a shot and I don't have to come back for a month?
No, I'm sorry. You have homework to do. So it's the same thing with people. You wind up taking like medication once or twice a day, depending upon what your levels are and how your veterinarian wants to treat your pet. Usually it is a pill. You can get it compounded into liquid if necessary.
It's a cute little tiny pill.
I know, and they're tiny, and you got it. If you lose it on the floor, that's it. You're crawling on the floor looking for it everywhere. Sometimes you can get it compounded into treats. Sometimes you can get it compounded into liquids. Either way, you're going to be giving your cat a medication once or twice a day to help decrease that elevated blood pressure and get all of the other pressure away from the organs.
We learned so much about medicating cats and how to go slowly when you can to make it not a war, but actually make it something they look forward to. Mm-hmm. So there's a ton of videos. Do you have any videos on medicating cats?
I'm sure Nova Cat does. Personally, I don't. I am horrible at video editing, so that's the one reason why. I'm sorry, people. This is one reason why I don't have a YouTube channel. I am horrible at social media stuff. Plus, I'm really, really busy.
Tabitha Kucera has a lot of really good ones too.
She's wonderful. That's what she does. Yeah, she's the one that does all the training, and she makes it look so easy. You're just like, I could do that.
The trick of it is you've got to start before the bad thing. That when the bad thing happens, it's not a big deal. But if you're in the middle of the bad thing and you're stressed and your cat, there are ways we could talk about them, or I'll have Tabitha on later, and we can talk about how can you do this to make it not such. I actually think it's damaging to the relationship, and nobody
can be.
Nobody wants that.
Yep, it sure can be. And then there are some cats that no matter what you do, they call the shots and they don't want it. We actually have one patient like that at the clinic, and we try everything with him. He's incredibly stubborn, whether or not it's client driven as well. I'll never really know and pull that information out of him. And it's like one of those things. And meanwhile, I had several cats with like heart disease over my period of time. All I had to do was pop a top of baby food, and they were like, I'm taking all of my medication. This is the best moment ever because I trained them.
Yeah.
So when you have a kitten and you start training them to accept treats, even just accept, pill pockets or whatever, and just learn that this is a good experience. I'm not hurting you, even though there's something in it. They're more likely to be like, oh, this is not that bad at all. I'm getting something out of this. So you have to have that kind of like symbiotic relationship with them, but you have to actually put the effort into it, which a lot of people don't have the patience for that effort. But some of the newer generation pet owners do, but some of us older generation pet owners don't.
It's very inspiring. So when you watch it, it's so cool. And I think
I think it's fantastic.
There is the lazy factor, but there's also that we think I can't do that. And you can.
Yeah, you can.
So we don't have a lot of time left, but I wanted to ask you about follow-up. So I found out I've got my other disease, my comorbidity that I'm going to be dealing with, but you also recommended that I go home with this medication and we're going to give it. What's next? Can I just disappear and never see you again?
No, dear God, no. And we have
Oh,
clients that do that all the time. I'm sure you have seen clients that do that. They finish the bottle of medication and they think, ta-da, the disease is gone. It's been treated. And then, fun fact, it's not. Typically in cats that are hypertensive, once you start them on medication, we have to see them back within 5 days. Typically, the best time is to check them between 3 and 5 days. It is recommended to check them at that period of time to see if that medication is actually working.
or working too much.
Right. You can make them have a hypotensive episode with it. It is so important. And that's why it's important to have these cats acclimate to the room, because we can get a false reading. And then we're like, oh, Dr. Liz Bales, I am going to script you out this dose. And that dose might be a little too high. So it's important for us to kind of check in with that client saying, how's your cat doing? Are these symptoms kind of easing up? Are they gone? Is he doing anything different? And if they are, we need to see this cat again. Then while we have,
most people,
I'm sorry, go ahead.
You know, there's obviously you go to school for a really long time to learn how to do this. Yeah. It's complicated. And I think if you haven't gone through that experience, it's really not intuitive to think that, well, you gave me the medicine, so why can't I? It's like, are we done here? But it's not an exact science. It's a cause and effect. So when we give you the medicine, it might be too much, it might be too little, it might be perfect. And it's not because I don't know how to do my math. It's because it's just not a thing. We have to check and then do our little dance of titration with those results. So we're gonna
you're working with an animal that has a high stress threshold, you know, so it's kind of like one of those things that you have to kind of like really pay attention to. And then once you get it under control, that animal feels fantastic. So it's important that you come back quarterly. If you're on medications and you have a comorbidity, you want to see your veterinarian sooner rather than much later, and make sure you get everything refilled properly.
If we're talking about math also, let's say I was super skinny. I'm not. But let's say let's say I was super skinny because I'm hyperthyroid. And in addition to treating my hyperthyroid and my blood pressure, you know, we've gotten all that straightened out and I feel great. And I've gone from a bag of bones that's like nervous all the time to chill, fat, and happy. Right. Well, in a cat that was 7 pounds, it's now 12 pounds. That change in weight can mean a lot to the amount of medicine that they need also.
Right. They may not. So say if you have a cat that's hyperthyroid, that's also very hypertensive, the cat is now treated and cured. So say if you did I-131, you wind up curing the cat of hyperthyroidism versus maintaining them on medication. There are times that cat will not need its, you know, medication for its hypertension anymore. So it's important to make sure that we either taper that cat off and take it off of its medication, versus making this cat go in these hypotensive episodes or living hypotensive for a long period of time. You still don't feel good in hypotensive episodes either. You feel faint, right? You know? Yeah. So that's really important that if you have a comorbidity that's being treated along with hypertension, that you make sure that it's either not progressing or regressing if it's being treated appropriately. Everything kind of works together. And that's one of the reasons why it's so important to maintain a good relationship with your veterinarian and actually be seen routinely. And that's why it's always important. Forward book your stuff, just like the dentist. My dentist texts me all the time. I'm like, I was just there 6 months ago. You know, same thing with your veterinarian. Forward book and get in ahead of time, especially now. It's harder to even see your veterinarian because the amount of pets that we're seeing and everybody who needs medical care. Be proactive about it, and you'll be much happier on how your pet's medical plan is going to go.
And I always say, you know, I had clients that I did not know. They didn't feel they communicated well with me. And it really hurt my feelings because I was trying all the time. But it's just like dating in a way. You're not going to have great chemistry with every single vet. And if you're going to be a person who really is responsible and taking care of your cat, you need to find someone that clicks with you and that you're happy with asking questions and you feel like listens to you. They probably are all listening to you, but if you don't feel like they're listening to you, you can look elsewhere. And so you brought up the AFP before. How would someone go about finding a new cat vet to really make sure they're getting their needs met and their voice heard?
Right. So you can go to catvets.com, and there's this nice little icon on the top that says find a vet. And you can find a feline friendly veterinarian in your area. There's tons of them. Whether or not they are a feline specialist, they still, on that list there, is they are certified as one of their feline friendly practitioners. You know, that you don't just get your name put on the website saying like you're a feline practitioner. They actually go through a lot of training and education to actually make sure that they are evolving their medicine to meet the needs for this species.
Well, I got Sally Jordan here who wants to know if she can check. She's a rock star. She wants to know if she can check her cat's blood pressure at home. Is that something that you have
Yes,
to
you can.
do?
Yes, you can. And
How
even Kristen with Basepaws checks her cat's blood pressure at home too. She actually contacted me on what machine to get. You sure can check your cat's blood pressure at home. If you are willing to spend a little bit of money, keep in mind some of the home kits, and many of them are quite accurate. Suntech is a fantastic brand.
do you
It's
spell
used
it?
in veterinary. Suntech, Suntech.
Okay.
It can be costly. That thing can go up to almost $2,000 depending upon the bells and whistles you want. But if you want to check blood pressure at home and you have a cat that's on blood pressure medication, that is perfect, because what happens is then you get to relay your cat's home trends to your veterinarian, and that allows them to do a comparison in the clinic and more accurately treat that animal. That you can be like, well, at home his blood pressure was this, or this, and at the clinic it might be sometimes 60, 70, 100 points higher because they're stressed out and they're in a non-stress, they're in their own environment, and you can train them to do it. They can be sitting in their cat carrier the entire time. They could be sitting on the couch doing it. There's so many different ways, but it's not, they are not cheap. I'll say that. But if you have a cat that you're like, I'm going to be, that owner, I want to go ahead and be very proactive about their health. Absolutely. You can get it. You get anything on Amazon nowadays.
So what age do you recommend that we start?
Personally, as a veterinary technician, because I am not a veterinarian, so I'm not allowed to actually, give my, my medical professional recommendation. Seeing so many cats over the past 20 plus years, I would love to see cats, regardless of age, come into the clinic and have their blood pressure taken,
And so
just to start following trends.
Now,
so if you are a year-old, wonderful. Many of the machines don't have stuff that kittens will actually tolerate. Usually that's when under anesthesia is the first time we'll actually get a blood pressure on these little guys to kind of follow trends. But annually, absolutely, if you just come in for vaccines, regardless of age, I think you should be having a blood pressure done. If there's something wrong with your cat, you're going to have it done more than once a year, particularly like every single visit you should. Kind of like many clinics, they'll do a temperature on an animal every single vet visit. At a lot of cat hospitals, including mine that I work at, we don't shake hands with a thermometer. If you're not feeling good, absolutely we'll take your temperature. But if you're here just for some vaccines, everything's doing good, we're not going to stress you out any further because some of the other diagnostics will reflect that. But yes, I believe regardless of age, you should be checking yearly no matter what. Once you start hitting the golden years with your cat and you're coming in more than once a year, absolutely every single visit you come in. So it might be twice a year, might be 4 times a year.
So I want to address money, because when we go to get the blood pressure taken at our doctor, our general practitioner, it's just part of the thing, and we don't get
you get your copay and you don't worry about it.
But in veterinary medicine, sometimes it's rolled into your charges, and often it's not, and you'll see a separate charge for it. Don't get mad at us. We're trying.
It's super important that what that tells you, those line items, that we are actually paying attention and making sure that your cat is actually getting, the necessary medical care it needs, and getting those baseline parameters is so important for us to be able to offer you and your pet the longest relationship you possibly can have. Everybody's goal is to have that 23-year-old cat. Not everybody's going to have that 23-year-old cat. I had a cat, Benny was 6 when he passed away.
He was so young. I'm sorry.
So it's like really important that like you pay attention to your cat and you stay on top of it. Does seeing your veterinarian every single year or more than, a few times a year, especially if they have a comorbidity, is that going to make a difference in their longevity? It may not. Ultimately, it's up to that cat's body that it's going to make a decision on when it's time. We can only do so much to kind of help extend, and it's the same thing in human medicine. It's basically about extending life through living through chemistry almost.
And I think another benefit that we don't talk about enough about seeing the vet annually, or more. You talked about the cat will be more acclimated and they'll feel better, like my example of not having gone for 3 years. But also, we have a relationship then. And we know how each other communicates, because when I would see someone for the first time, for instance, their cat, they haven't been to the vet in 7 years, 8 years, ever. And the cat, well, we get this, you know what I'm going to say. They fell down the stairs and now they're screaming. And they can't move their back legs. And if you're the owner of that cat, you are beside yourself. It's a lot to see and process, and your cat is in severe distress. And we're going to have to talk about some really hard things. And if it's the first time I'm ever meeting you, it's really, really hard for you to hear me. It's
right. And how awkward, is that to have that first conversation? That might also be the last conversation that day. It's very tough on everybody all around.
But if we know each other, I'll probably even be more sad because I care about you. But if we know each other, then I can help you better because we already have the established rapport. In good times and in bad, we want to be there. For you.
Yeah, absolutely. And it's fantastic. I've had the privilege of seeing cats now at this particular clinic from when they were kittens to when now they pass away in their late teens. And it's always like an amazing story, or it's amazing that you see a client come in and now they have their second or third generation of cats. So yeah, building that relationship with your veterinarian is so important. And believe it or not, we actually remember you guys. Like, we get all excited when certain cats come in. Sometimes they're more the frequent flyers that come in that we're like, oh my gosh, this so-and-so's coming in again. Or you'd be like, oh my gosh, I remember so-and-so. He was so cute last year. So, it's just not a quick in and out, and we don't build a relationship. We're building a relationship with you on these sub levels I don't think people really understand or actually take for granted. Like, we actually, go out of our way to try to connect with you at the vet office.
It's what gets us through all the sad stuff.
Yeah.
Caring about you. Yeah.
For sure.
Well, thank you. They say we're supposed to talk for 20. I can't talk to anybody about anything for 20 minutes. I'm barely done saying hello in 20 minutes.
Right? Well, if everybody wants to know more about blood pressure, they're welcome to go to the catvets.com. There you can look up the blood pressure toolkit, and it's public access. You can see what it's all about. You can see how blood pressure is defined, how it's maintained, how it's recommended to work with cats. Like, the information's amazing. And I was part of writing that toolkit. It was a wonderful privilege.
You guys are in the presence of greatness here. And the thing I love about catvets.com is it's written by the people who are doing the research. We know everything that they're putting out is the latest in science-based information. So it's not what someone guesses or hopes for or happened to one cat in the past. I mean, this is the creme de la creme of information here. So if you have a question about anything, check them out first. And do what you got to do, but put them in your toolkit. And
Cat Friendly Homes also gives you fantastic little tips and tricks on how to get your cat to the vet, all that stuff, how to build a relationship, everything. I think those websites are very underutilized by the public, and it should be very utilized by the public. They're wonderful resources of information.
Well, I'm here to make all of the world famous cat vets in veterinary world into rock stars, and to make the science-based websites more popular than YouTube. So give me a minute. I'm trying.
You got it. It's going to be like Liz Bales and the little feeder mice in the background, and you guys have like your own like rock band going on.
We need a little dance and some things. Yeah. Thank you so much. I know that you work a million hours a day, and then you go home and take care of your crew. revolving scratch and dents, as you call them. That's so cute.
Yep. Writing guidelines, all that stuff. Super busy person trying to kind of help out as much as I possibly can in veterinary medicine.
We really appreciate it. The collective we. Thank you so much. And thanks for spending your time here tonight to explain.
Thanks for having me. I always love chit-chatting with you. It's always wonderful to catch up and talk about cats and medicine.
No, we'll have to catch up off air and talk about the rest of the blah, blah, blah.
Absolutely.
Thank you. Everybody have a great night. And
Take care.
On Thursday, we're going to be talking with Dr. Margie Sharrock for an hour, which will probably in Liz World. I mean,
I love Margie. She's fantastic. You guys have got to see if Margie's involved, watch it.
So much fun. Yeah. So we'll see you then. Bye, everybody.